Today's session will highlight the Adverse Childhood Experiences Study, the ACE study, the largest study of its kind, which confirms with scientific evidence that adversity early in life increases physical, mental, and behavior problems later in life. This training will explain how the study was developed, why the results are so important, and it will explore the impact of ACEs on brain development. This training hopefully will inspire you to re-examine how you look at and respond to classroom management, behavior problems, and developmental delays, and will provide practical interventions to help you support and develop student resilience, protective factors, and skills. Clark Fairbanks, excuse me, is the Assistant Director of Youth Emergency Services, known locally as the Yes House in Gillette, and he is a certified ACEs and trauma-informed care trainer. His career has spanned more than 35 years working with youth and families. He began in 1985 at a youth corrections facility while he was a social work student at Bemidji State University. He transitioned to Evergreen House, a runaway and homeless youth program where he progressed from part-time youth advocate to the executive director. In 1992, Clark moved to Wyoming and served as the executive director of the Yes House. From 2005 to 2010, he was the superintendent of the Wyoming Girls School. He returned to the Yes House in 2011 as the assistant director, where he continues to pursue his passion for improving the care and treatment of youth and families through training and advocacy. Wendy Gaunter is from Gillette. She's an adoptive mother, an educator, and community advocate. She holds a Bachelor of Arts degree in education and a Master's of Science in Adult Learning and Technology. She's a trained yoga instructor, community educator, mindfulness-based stress reduction educator, presenter for ACE Interface, Neuroscience, Epigenetics, ACEs, and Resilience and Protective Factors for Families. Wendy graduated from the Gillette Area Leadership Institute in 2004 and is past National Teacher Policy Institute Fellow. She was a special educator and teaches parenting for Climb Wyoming. Please welcome Clark and Wendy.
Thank you, everybody, for having us. Yeah. We appreciate you being here. We just want to get started and let you know we're going to be talking about the impacts of adverse childhood experiences, and we'll start by looking at the biological and neurological impacts of chronic toxic stress. We'll talk about the ACE survey and some of the data relating to that. And then we'll close by hopefully giving you some practical tools and things that you can learn and use in your classroom. So hopefully you'll come away with some hands-on information going forward. So thinking about ACEs, what we know is the ACE study has led to one of the greatest health discoveries of all time. And also we had the clicker problem last time, so I'll just go ahead and say that all of the information that we take in every day from our environment is recorded in our bodies.
Yeah, that's recorded not just in our mind, but in our bodies. And it starts to develop who we are and who we will become.
So looking at synaptic density, when we're born, when we have infants, they have very few synaptic synapses. And so all they really can do is cry to let us know, hey, I'm uncomfortable, I'm tired, I'm hungry. And as nurturing parents, we're able to understand, know what those cries are, and react appropriately in taking care of the problem. And so in elementary school, we see this arborization of synapses. So children are taking in information all the time, and all of that's being recorded in their brains. and it's just in there, and they just are eager to learn. And by the time we hit puberty, the process of pruning begins. And pruning is really the part of our brain where it starts to organize information in a more effective way. So if you imagine a really busy highway that's always just cluttered with traffic, when you have a community that can then like rearrange traffic patterns and all of a sudden it moves smoothly, that's what's happening in puberty. So what we know is all the things that are really, really well structured, all of the synapses that are reinforced over and over and over again, they stay, and they get coated with a fatty tissue called myelin. So myelization starts to happen, and then those synapses eventually come to the frontal lobe and they have better executive functioning. So looking at the growth between having an infant, an elementary school person, and then someone in puberty, I think what's important to think about is, as secondary teachers, a lot of times what we think about is our kids should be adults. They should already know how to do this. They should be able to, they should. And what we want to do is challenge the narrative to think about, if a skill has not been developed and it's not part of that myelization and it's not reinforced in their brain over and over and over, is it possible that their organization in 9th grade is just a skill that's not developed, rather than the laziness, I don't care, I'm not doing that narrative that we often hear?
Well, every child's development is unique to them and their childhood experiences. And for illustration purposes, we're going to just show you two distinct differences in childhood experience. In the top arch that we have projected is a child who grows up in danger and experiencing trauma and abuse, and they adapt to those life experiences in predictable patterns and predictable ways. And so they start to learn that adults are dangerous at times, that if I'm going to have my needs met for that child, they often have to meet them themselves. They have to meet their own needs. They also become very sensitive and acutely aware of their environment, identifying danger, responding to that. They have a heightened sense of development around fight, flight, or freeze, and they've learned to survive in some of the worst conditions. As an alternative to that, we have a child who grows up in relative safety, where parents and caregivers are there to help meet their needs. They teach their children to be able to use words to express if they're afraid, if they're hungry, and they nurture them in their growth and development. So they start to learn that adults, even if they're not our primary caregiver, are people that I can trust, that are there to help me learn and reach my possibility or reach my potential. So they learn to survive and develop in the best of conditions. And so we start to see two different populations that obviously you experience in your classroom, and they interact with their peers and with you very differently. If you look at the child that grows up in a highly unpredictable environment, they're going to be less attached to adults and teachers, maybe far more sensitive to and relate more just to their peers. Sometimes those are peers similar to the environment that they've experienced in their life. And so there could be more conflict in that, harder time sitting through class, meeting adult expectations, as opposed to the other child who is more connected to adults, sees them as role models and people to strive to meet their expectations. And so that starts to bring into place some feedback loops for them. But it's important that we recognize that both have adapted to the environment that they have grown up in and are acutely skilled to move forward based on those life experiences.
And so what we want to ask ourselves is, thinking about how children grow up in chronic toxic stress, the characteristics that are developed under those conditions are considered still adaptive. They're not maladaptive, they're well adapted to their environment. So what types of careers would lend themselves to having those types of characteristics that prevail in chaotic situations? And so what we might think about is firefighters, police officers, military, doctors, trauma nurses, ER physicians, ER nurses, and I'm just going to say teachers, potentially administrators, governors. So all the people who can find chaos comforting often make great have great qualities in those kinds of chaotic environments. And what's important to understand is that comes from a strength-based framework. So thinking about a kid who might be really active all the time, and you think that kid has so much ADHD, the narrative that we want to think about is, wow, that kid has a lot of energy. How can we harness that? So thinking about, and also I want to say, not all firefighters, right, have been raised in trauma, and that's what makes them great firefighters. However, that is true for some. And so just noticing that some people can really act well because they're used to acting in that environment.
For our discussion today, what we really want to talk about is those environments that come into our classrooms, come into our interactions with adolescents, where our children's life experiences create those adaptations, come in conflict with our societal expectations, the expectations that we have in our classroom and our schools. So when that biology collides with our social expectation is where we start to get those negative feedback loops. And those can be a pattern of feedback loops that are negative to that child, that start early in life and can continue if unrecognized as trauma and without interventions. And that can continue through life. But being trauma informed and being aware of how adverse childhood experiences set the stage for, and often our children lack the skills that other children have developed. And so setting up those environments where we reinforce pro-social adaptive skills in our classrooms and in our environments, the earlier we start with those, the quicker our children can develop those skills. As it gets to later in life, it obviously takes more time, more repetition, and is more difficult to achieve. So our message here is really around using a trauma-informed approach and using the research that shows how to do that.
So what we know about the effects of maltreatment, these slides on neurology have been developed by Dr. Teicher and his research at Harvard University. So what they know about the effects of maltreatment is that it affects children differently. So what looks like trauma in one kiddo might look like something totally different in another kiddo. And it depends on the type of maltreatment that's been experienced, the gender of the child, and the age at which the maltreatment occurs.
And so that trauma, first early in life, impacts significantly the limbic system. And that limbic system, obviously the brain develops and grows from the brain stem up and forward. But trauma early in life impacts the child's ability to regulate their heart rate, their hormones, their stress levels. It impacts sexual behavior. It also impacts their ability to learn, their memory, recall, and makes them acutely desensitized to reward and reinforcement, and the reverse of that, consequences and punishment. Why the typically developing child that has not experienced trauma it responds well to rewards and reinforcements that a traumatized child does not.
So looking at the amygdala and the hippocampus, the amygdala is our reaction center. It's our fear center. And it sends us into fight, flight, or freeze whenever we're feeling overwhelmed or when we feel like there's danger. For kiddos who have been impacted by trauma, their amygdala can be physically bigger, meaning that their reactive center is far better at reacting than their executive functioning or their frontal lobe thinking. So they might not be reasonable thinkers all the time, and they might need help to really back off from that amygdala. If you have experienced maltreatment from the age of 0 to 3, what we know is that is the most impactful developmental stage that creates long-term consequences for behavior in children. So something that happens or doesn't happen from the age of 0 to 3 is particularly impactful on behavior later on in life. So you may have a child who doesn't express that anything has happened, but perhaps something very significant has happened from the time they were 0 to 3. That impact will show up in their behavior and in some of the brain development later on. That's particular. Oh, and sexual abuse from the ages of 0 to 5 is particularly important to understand that this is where some of those behaviors are originating. It's not a willful choice. It is a biological response to environment. So looking at the cerebellar vermis, this part of your brain is the mental health part of like our brain structure. So this is where dopamine, serotonin, norepinephrine, all of those neurotransmitters live in this part of the brain. And so this is when we're well balanced, when those neurotransmitters are working well in a typically developed human being, you're going to have positive feelings. You're going to perceive the environment potentially as exciting, maybe joyful, and you'll be able to hold your attention. You'll be able to focus. You'll be able to feel motivated. This part of the brain, when it is negatively impacted by chronic toxic stress, then you're more likely to find attention problems, mental health issues, and addiction. And that's because of the way that the neurotransmitters are working in that part of the brain. So anybody who is always moving or smoking, doing different things to looking at their phone, that's always a dopamine hit. So dopamine seekers are often people who have been in really highly chaotic environments and who need that kind of sensory stuff during a class time when they're asked really to be quiet. So it's really in contrast to what they're able to do and what their brain is telling them that they need.
And just one example from my work as the superintendent at the Wyoming Girls School, we had many of the girls who had been abused methamphetamine or were addicted to methamphetamine, and amphetamines and stimulants often trigger that release of dopamine and norepinephrine, and it depletes this area of the brain and the chemicals that they need to feel positive and healthy. And so for us in our work and for you working with children who may have addiction issues, being aware that that's an area that may need to be assisted through medications. It may be an area that needs to be healed when there's substance use and abuse. And the research is just becoming much better and the treatment's much better in helping the brain heal. So children who experience 4 or more ACEs are 3 times as likely to take ADHD medication when compared with children with less than 4 ACEs. And the reason for that is often that trauma is exhibited in behaviors that often look like and resemble ADHD.
I guess I would just add too that some of the most diagnosed mental health illnesses in secondary students is really the symptomology is exactly the same for trauma. So all that to say, it's very difficult to probably meet out who really has a genetic predisposition to depression versus someone who has experienced chronic toxic stress and adverse childhood experiences, and as a result have developed in their cerebellar negative impacts to their neurotransmitter wiring. So just again, challenging our narratives around who our secondary students are. Like they're just starting to develop their identity, and oftentimes what happens is if they've been impacted by trauma, we're starting to see some of those impacts even more pronounced in this age of child. In particular, the Corpus Callosum, which is, so first I want to just think about this, particularly junior high, like 9 to 13. For kids, it goes on much longer, potentially all the way up until you're not really an adult until you're 25 or 30, right? So just remembering, like, this is a very impactful developmental time. So you as teachers, really, this is not, kids are not developed, right? I think sometimes our narrative is they should be able to do a lot of things because they need to be adults, and the adult world doesn't work that way. That's a narrative I've heard often. And what I want to challenge us to say is, this is really the best time to figure out what skill development has not been learned so far, because that means there's a challenge to that learning in the brain. So the corpus callosum is responsible for higher order thinking skills. It's responsible for higher processing level skills. It's responsible for relationship development skills. And so just thinking about, this is the part of the brain that bridges the two hemispheres together. So you're looking at, like, what is spatial patterns? Math and calculation is really interesting. That part of the brain is responsible for math problems and math calculation. So if you have a kiddo in junior high and high school that, like, never quite got their math facts, this might be a trauma-based response, or it may be a special education learning disability. But either way, it's interesting to think about things as a trauma response, right? The way that they speak, grammar and vocabulary, processing routine situations. So if you have a child who comes in and you tell them how to come into your classroom all the time, and you've said it for the last 2 weeks, or you've set your rules for the classroom, and, like, these are, junior high kids, they should get it. I should tell them once, right? Get them once, and you got them, right, buddy? And I think it's really important to understand that routine situations for kiddos who experience trauma and regulation deficits is really hard. So I might come in and follow your directions 4 times in a week, and the 5th day is a disaster. And I don't remember, and you tell me, like, come on, I've told you this 4 times in a row. How can you forget? What we want to think about is the way that we can show skill mastery is we have to be in the right frame of mind. And remember, kids who have an enlarged amygdala are going to be dysregulated probably a lot of the time. So what happens in the morning at home might really have an impact on how you can demonstrate skill that day. So really understanding that if kids are spotty with what they're able to do, it's a state of being issue. It's not a skill mastery issue. Anything you want to add, Clark?
I think that I think for us as professionals, what's important is we may misperceive that as willful or disobedience because they've demonstrated they can do it, and then we think that they're choosing not to do it. And really looking at a trauma-informed approach, if we know that child has likely experienced significant traumas, of recognizing that is that they don't have the skill or can't access the skill at that time when they need to. And that's really critical around behavior and being able to self-regulate themselves in situations where they're escalated, where they're in experiencing fight, flight, or freeze due to sensory stimulation. Could be sense, visual cues, auditory overstimulation that can trigger that, and then they're not able to access that at the time.
So neglect in infancy for boys is particularly impactful to brain development, and sexual abuse in girls ages 9 and 10 is particularly impactful to brain development. So just thinking about how, remember I talked about sometimes things can happen, birth to 2, and you as the student may not register that it has anything to do with you flipping off your teacher today. And yet what we know from brain development is what happens, and what brain development from 0 to 3 is enormous, right? And here you have another developmental stage in adolescence where brains are coming online in a different way. So there are seedling cells that are planted in your brain, like they're just part of your brain structure when you're born. And what we know is those seedling cells start to grow and they start to develop in adolescence. So this is why it makes sense that if you are neglected in infancy, those seedling cells become impacted by chronic toxic stress. Our bodies are only designed to be in stress for about 20 minutes at a time. And then our bodies are designed to get rid of those toxins, which are cortisol and adrenaline and whatever else, neurotransmitters, right, are released. And so if you have a child who lives in a situation where there's chronic toxic stress, always cortisol, always adrenaline, that starts to impact body functions, organs, cells in your body, but it also impacts those seedling cells, so they may not develop in accordance, like commensurate with peers. So what we want to be really thoughtful about is if a child is not meeting your expectations, it's an adaptation, and it is possible that they simply do not have the skill to do that. And if you think about how a reaction that's strong, perhaps like disproportionate to what's happening, is really an amygdala response that, unless you know what's happening, is very difficult to control. Do you want to add anything, Clark? Okay.
Now, then we look at bullying, and bullying between the ages of 7 and 13 is when the brain is particularly sensitive to bullying, which is in addition to, the typical things we think about in bullying is children being mean to each other, saying hurtful things, but also the imposition of guilt and shame. And in the brain research, what they've seen is that the mind and the brain's development is negatively impacted by that, but it doesn't differentiate between bullying that occurs from a peer or a parent, or a peer and an adult. And so again, it gives us some idea of the importance of bullying prevention and creating safe, emotionally safe environments for our children, especially in that developmental stage of 7 to 13. And I often think about what's happening developmentally for children in those age ranges where their sexual identity is starting to develop. And access to social media, having a phone, and the importance of, for parents, really protecting our children during that developmental stage from bullying.
And how important it is to have a culture of safety in your school. And I just want to mention, it's worth thinking about the policies that we have in terms of how we create a culture, and thinking about what we say on paper versus an actual implementation, right? Because sometimes, as we know, theory and practice don't always work together as well as they should. So we have a collective choice, right? This is neurology. If you buy what we're saying, which we're always welcoming you to go Google things that we're saying, because we may not know what we're talking about. And so if you look into that, we have a collective choice, right? If this is not willful disobedience, if this is not something that people are doing personally to you in your classroom, then there is neurology and biology behind all of this. So how and why do we need to address this?
And we challenge you to look at it in a new way, not what's wrong with a child when we see that their behavior is unregulated, that they have emotional outbursts, to see that not as what's wrong with them, but to change that to what's happened to them. And that really leads us directly into the ACE study.
Right. So the ACE study was developed, it started in 1994. Do you want to go to the next slide? And Dr. Folletti from Kaiser Permanente just started to notice an interesting correlation between patients that he had in particular and childhood events. And what he was studying at, actually worked in a weight loss clinic. So what he discovered was women who were obese had more often than not endured sexual abuse as children. And when he started to put that together, he wondered, as an epidemiologist, what was so interesting. Were there other things that might happen in adulthood that ended up in having, adult consequences? And so he and Dr. Robert Anda from the CDC, and Dr. Robert Anda was the person who trained us on this information. He developed all of this PowerPoint for you and trained us what to say about it. So Dr. Anda and the CDC continued this research for over 20 years. So this has been well researched. It's been redone tons of times by other people. And what they discovered is there's a huge correlation between what happens to you as a child in development and negative health outcomes as an adult.
So when we look at those, what they found is really three domains of childhood trauma, that the first one being household dysfunction. So it asks the question, and the responses are alongside that. Did you grow up in a home where substance abuse was present? Was there parental separation or divorce in your home as a child? Was someone impacted and affected by mental illness? Did you experience a home where domestic violence was present, or was someone involved in criminal behavior? On the neglect side, were you emotionally or physically abused or neglected? And then were you emotionally, physically, or sexually abused? And these are self-reports from adults. And beside that is the national response rate for people who have experienced that in their home. And what's important is that, so it's the adult's perception of what they endured as a child. It's not intended to be an assessment instrument for youth or children, but the frequency at which it occurs is what we really want to stress, and so that we start to look at how common childhood trauma is present.
So Dr. Anda was really careful to let us know that this is not a screening tool. And also, I think we should share in our training, there were people from across the state who were employed by the state who had, jobs and were
Families.
useful people to the community. And our response rate was higher in that we had more ACEs in that room than the national average. And so just to know we're not our ACE score, that's not what we're talking about. What we're talking about is, as educators, as an educational system, how do we help put up protective factors so that anything that happens to a kiddo, if we have any control over that, we can control it. And if we don't, how do we mitigate the impact of that? So looking at ACEs, for example, nationally, only 1/3 of us can claim that we have 0 ACEs that have happened to us over a lifetime. And these are respondents that are 18 years old and below, and this is self-reported. So siblings can have different ACE scores. People perceive their environments differently. One ACE score, 26 people said, yeah, I have 1 ACE score. 16% had 2. And the most important thing to pay attention to here as we go forward with the data is people who have an ACE score of 4 or higher are more likely to encounter negative feedback loops and negative outcomes as adults.
So when you think about your classroom, you can project that in relation to the general population, approximately a third of your children in your classroom may have 0 ACEs, which means 2/3 of the children in your classroom, and based on their age, they may be either have experienced trauma or are experiencing trauma. So we start to get a picture of what might be impacting their ability to learn, their development, and their behaviors. And again, that shift for us of looking at it from a trauma-informed approach. On these couple charts here that just look at, on the left axis, what we have is we have the frequency or the percentage of risk that each category has. So early childhood smoking, as you can see on the y-axis, if I have 4 or more ACEs, I'm 7% more likely, or I'm sorry, 14% more likely to have early smoking initiation. And what Dr. Anda defined that as is ages 13 or younger. So then we start to think about not only smoking, but use of tobacco, chewing, and vaping. I suspect what we'll see is over time with the prevalence of vaping, this will become even higher. And then currently smoking, we start to see the impact on adults and their inability to for cessation. So 17% more likely to be a current smoker if I have 4 or more ACEs, and then developing chronic health disease from tobacco. And just to recognize anxiety, smoking tobacco is really an effective, unfortunately, effective way of helping people self-medicate for anxiety and depression and difficulty concentrating. So you think about the child in your classroom who has multiple traumas, who might be experiencing abuse or neglect, or someone in their home with mental illness, and why they're at higher risk for using tobacco or other means of self-medicating when they're going through that.
Can I jump in really quick and talk about solutions? Okay.
Yeah.
So one of the things that Dr. Filetti discovered in his weight loss clinic was he could treat people by like controlling their calorie intake. But what was interesting is, and I think this speaks to solutions as far as educators, right? We have positive behavior interventions and stuff that we're supposed to do, right? But I think it's important to sort of put this piece of information into that, which is what's the solution? Because when people have their calorie reduced, they lost weight. And the interesting ground zero patient that Dr. Filetti had was a model patient until one day she had lost, I don't know, yeah, like 250 pounds. Let's make up a number. And you can check this on the internet, please, because I may not get all the details right. What I know is she went to work one day looking really terrific, you know, feeling great, lost a lot of weight. And her coworker was a male and said, hey, do you want to get it on tonight or something like that? Like something inappropriate in the workplace, which is now sexual harassment. Don't do that. And she went home and she started night eating, which is what her, that's what had happened. And that's why she had become so large, because for her, she had been sexually abused early on in life. Weight was a nice coping strategy, lost the weight, and a male coworker came at her in a similar way that was sexually uncomfortable. And she started night eating and literally gained weight, despite the fact that her calorie intake and Dr. Filetti's program was effective. I guess that's to say the solution to the problem, the calorie intake part, we think that that's the solution. But for her, the solution for all of those uncomfortable feelings was eating a lot. And when we take away the solution to something that's really painful and leave us with nothing, then it's very likely that the behavior will return. So if nicotine works for you or marijuana works for you, it's very difficult to just try saying, hey man, can you lay off the marijuana and let's play cards instead. That's not going to be effective, and you're taking away their solution to the problem.
Yeah, and it's really reinforcing what we know. We have to replace that with a pro-social, a pro-healthy response, and address the underlying issues, in this case, trauma. and teaching those skills that are lacking in being able to do that. In this slide, we're also looking at depression, the correlation between ACEs and depression. General population for women, 18% experiencing clinical depression. For men, 12%. As you look at 4 or more ACEs, for women, you're looking at 60% struggle with chronic or clinical depression. It states 39% of men who have 4 or more adverse childhood experiences are suffering depression. As a male, I would just suggest that it's likely very similar. I think men often don't recognize what they're feeling, and being able to identify that as depression or underreport it as related to depression, what they're feeling.
I think too, for secondary, it's important to think like depression can look like aggression in males as well. So looking at ACEs and suicide attempts, you can see that the dose response to the number of ACEs that someone has does sort of dictate the outcome of how many suicide attempts are likely. And people with 4 or higher obviously have a tremendously more suicide attempts than let's say a student with an ACE score of 0. So just thinking here about what do our prevention programs look like? How do we talk to kids about suicide? Do we teach them about neurology and how chronic toxic stress impacts their bodies and how trauma can make them feel sad or depressed? So teaching those things can be helpful, but overall just recognizing that trauma plays a large role in suicide attempts.
And I think how it relates to our working with adolescents as well is really creating an environment that's trauma informed, that recognizing that when our kids are struggling, that what might be underlying that are adverse childhood experiences, and then creating a structure within our classroom or within our schools that really builds on resilience and protective factors, while being aware not to have institutional trauma that is not intended but sometimes can occur. And so taking the approaches that we can to be able to work effectively with a trauma-informed approach.
Looking at ACE-attributable problems, this is just sort of a generalized overview of different kinds of health outcomes that people with high ACE scores may experience.
And here we have really the research around if we can lower the ACE score of children or in our community, the reduction of ACE attributable behaviors that we can reduce. So if we can lower and eliminate ACEs, we can reduce marijuana use by 54%. We can prevent 67% or reduce suicide by 67%. And so it draws that correlation again to the importance of, if there's ACEs, we can't erase them, but our goal is no more ACEs, and then generationally working to make sure that we are putting in place systems and educating parents on the importance of protecting our children and preventing adverse childhood experiences.
So when we look at community outcomes in particular, this is kind of a narrative, right? This is a narrative that we see and hear all the time. And sometimes as adults, we don't even know how to disrupt this narrative. But we have kiddos who have ACEs, and their cognitive skills, their attention, their behavior results in academic failures, substance use. They get kicked out of class, they get kicked out of school, they drop out, and then they just encounter adult adversity, which is, low wage jobs, disabilities, chronic health problems. And so for some kids, this becomes the narrative. And what we're trying to invite everyone to do as educators is to think about, how can I contribute in a strength-based way to children's lives so that they adapt more towards the person who believes, yeah, I can be a police officer and contribute to my community versus I'm an academic failure, I can't do anything. And the negative feedback loop then just reinforces all the negative aspects of their characteristics.
Well, if you're like me, at about this point in the presentation, when I was receiving the training, I was feeling pretty depressed about this correlation.
It's depressing.
And again, what's important for us to convey is this is really a hopeful message, because what's predictable is preventable. And that's the public health model. If that knowledge is power, if we know that our children are at higher risk based on the number of ACEs, and we know how we can build protective factors and help them build the skills that they're lacking, we can prevent that from occurring. We can prevent poverty and homelessness, as this example shows, in our children. And we'll talk a little bit more about that, quite a bit more about that, as we move into actual interventions that work to build resilience. So resilience trumps ACEs.
So looking at this, well, this is just an overview of what we talked about, right? Adverse childhood experiences leads to disrupted neurodevelopment, leads to social, emotional, and cognitive impairment, all the way up to early death. And research shows that people who have a high ACE score often die 20 years earlier than their peers because of negative health outcomes. We also know that the biological, physiological impact of ACEs is that it does get transmitted generationally. It's a genetic, epigenetics tells us that, like, for example, if I'm a kid, I grow up, I have a large amygdala, I have trouble, calming myself, that large amygdala gene, right, will become an expression that gets passed down through the generations. So intergenerational trauma is something that we see often, and we kind of might say things like, oh yeah, he's just like his dad. And that's what we're talking about. Perhaps the parents have lacking skill development in certain areas, and that's been passed down onto their children. So how are we able to sort of share that information and support their family?
And again, our goal is to reduce ACEs generationally. So each generation, we can reduce the incidence of adverse childhood experiences. And we might think, well, geez, that's a long-term strategy. I'm not sure I'm into it for that long. But Dr. Anda challenges us to think about if you have youth and young adults who you have contact with who are of childbearing age, we can have a generational impact now by them understanding how adverse childhood experiences can impact their child, and how we can prevent that from occurring in newborn children. We can have that generational impact today. So we have the power to shift the dynamics that lead to high ACE scores. And we're going to talk a little bit now about how, by having that framework of understanding how childhood trauma changes the development of the brain, and what we can do in our day-to-day interactions with children to shift that and to build the skills and capacities that children need.
And just a reminder that if you have questions, please feel free to type those out. So looking at the core protective systems, this is something that I want maybe to invite you to think about in your classroom, right? The capabilities, attachment and belonging, community, culture, and spirituality in your classroom. The capabilities component is really a strength-based framework. So we're asking I think trauma-informed care is really about thinking about your classroom as a family. And trauma-informed folks like Jim Sporleader, for example, if you've seen the documentary Paper Tigers, he was featured as the principal in that alternative high school. It's a fantastic documentary if you get a chance to watch it. But he talks about a strength-based framework, and with also the knowledge that our expectations that don't meet adaptations doesn't mean there needs to be punishment, but rather there needs to be a conversation about holding the children accountable. I think that's always something that's really important to say. If you're trauma-informed, you're more likely to hold a child accountable than back off and not do anything or just expel them, right? So his framework was, I'm not expelling anybody. He had a kid smoking marijuana in his office, and he said, please go home because you're doing no good here. Called the parent and said to the parent, send your kid to school in the morning because I want him here, not at home. And so that framework, thinking about a strength-based approach, means also thinking about what skill development is needed here so that we can provide that. Do you want to say anything on capabilities?
I think that it also, for many of our adolescents, they're often lack hope, especially when they've experienced significant trauma. And they have a hard time seeing their way out of that experience, but also seeing themselves meeting our expectations. So they have a hard time seeing themselves passing your class, being a graduate of high school. And so core protective systems and building those capabilities is really about instilling hope and belief and rewarding, or not necessarily rewarding, but promoting that those capabilities, that they believe that they can do more, that they have those capabilities.
Yeah, so when I teach parenting and climb, which I think is applicable to all of us as human beings, which is always expect the kids to act appropriately. Always expect them to do the right thing. And just like they're expecting life to hand them the negative feedback loop, I'm gonna bet some of us have kids in our class where our feedback loop is already like, oh boy, here we go, right? I'm not gonna expect this kid to do the right thing. Every day I know he's gonna come in and do something. And notice I had my own narrative of it's a male. So gender roles also, just putting it out there, important. Attachment and belonging is really about setting up a culture of safety in your classroom. And one of that is to be self-reflective about what are my feelings on different cultures, on different races. I just like totally blew my cover on gender roles. So I think all of us have to be reflective about what we bring into our classroom. How do we feel about people who are aggressive or violent? Like, how do we respond to that? And please don't mishear me. Like, don't hear me think, hey, hang out in my room and blow it all up. No, but holding people accountable means we're creating an environment that feels safe here. I'm also going to invite us to think about like a secondary people. Brain development in adolescents, research shows us that they're really bad at facial cues, very bad. Like people will look frustrated and they'll think that they're mad. In fact, I think that people are mad most of the time or happy. That's about it. So it's very important to consider how we're using things like sarcasm and how we're reacting, like if we're just furrowing our brow, because just know adolescents are very bad at reading that. And you all are secondary folks, so I'm not telling you anything you don't know. You know that they're not good at that. But remembering to create an environment that feels safe for everybody in the classroom. And okay. And then the community. Oh, the other thing I would say is if you have anything up that feels like you're trying to motivate people by, having charts about who's done what or whatever, I'm just going to invite us to think about, is that necessary? Because telling kids that you're going to give them a 0 is not effective in skill development.
Well, I think it comes back to that. no different than how we want to be treated. I mean, we don't want to be called out in front of other people and publicly shamed. And sometimes kids who struggle with that and are underperforming, and that's presented in front of the whole class or to the whole class, can create those environments where they feel called out and can be demeaning to them.
Yeah. I don't know about you, but I've known people who get called out and they aren't very nice about that. It might look like a reactive expression of emotion. The other thing, community, culture, and spirituality, creating a community in your classroom that feels like where people want to be, right? And also being culturally sensitive to expectations. For example, and I feel like many of you could probably give better examples, but the first thing that comes to my head is requiring kids to look into your eyeballs when you're talking to them. Some cultures and even some kiddos who have trauma are just not able to do that because it's very intrusive. So being culturally like aware and sensitive to what kids are giving you is kind of part of developing that culture.
So I realize this is, I really know that those are the environments that you are creating. And we're just really trying to put this together very succinctly about what makes the difference. What makes the difference for kids, especially who have experienced trauma, who are struggling with not having the skills that maybe their peers do, of being able to self-regulate, to be able to learn as quickly and adapt as quickly as other students. And so just as a recap, I often think about thinking back on your past as a child, of the people who inspired you, thinking about the person who you connected to that made a significant difference in your life. Who were those people? In a more interactive training or environment, I often hear people say, I had a teacher that when I think back of my childhood that made the difference. And I ask, and how long was that teacher in your life? And so, or a coach, or could be a grandparent. But when you think about a teacher or a coach that might have been in your life for 1 or 2 years, you really start to see how we can have a profound impact on a child who might be struggling and have a very brief period of time in their life. But it's often about that person took the time to understand me, to look at, gave me hope, gave me encouragement unconditionally, challenged me to be what I could be. I felt like I belonged to that person. I was part of that community. And so that's just an example of how we can have a profound impact by creating core protective systems for our children. And again, that resilience that we create helps our children overcome the negative impacts of trauma. So it inoculates them from the adverse experiences of trauma.
So looking at family protective factors, I bring this up because I think it's really difficult to know how to engage parents, but parents have the power at home to do a lot of different things. One thing that we want to think about is parental resilience. Are our parents resilient? So if you think about during this, time of learning, I imagine some parents are overwhelmed by trying to work and get their kids to school and then having their kids quarantined for 2 weeks and thinking about how do I manage that, right? What a wonderful time for us to really be not just figuring out our own stuff in the system, because that's hard enough, thinking about what a wonderful time it is to teach resilient skills to parents. And what that looks like in some of our other programming is it's really helping parents know, like, I can help you think about a problem and help you solve it. Because if parents are stressed, they're not able to think about solving problems. And resilience is really about knowing I can solve any problem that comes my way again and again and again. So how can we reach out to parents and create resilience? Particularly now, because it's a perfect time, right? Like we're all probably struggling a little bit with resilience. Creating social connections. This is really interesting because the more social connections parents have, the better off they are because the more support they have. And what's interesting is if you think about how kids like meet other kids, when they start to go to junior high, high school, parents are really sort of not involved anymore in like bringing kids together. And so there's dropping off, but there's not connection. Thinking about how do we bring social connections to parents so that they have their own support system. Talking about child development, you know, child development doesn't stop after elementary school. So thinking about how do we talk to parents about what's typical? I mean, adolescents are hugely vulnerable to substance use. They are hugely vulnerable to sexual risky behavior. And so all of those things we want to talk to our parents so that they know what's appropriate, right? So that, you know, if so-and-so is out drinking one night, it doesn't mean that they're addicted all of a sudden. However, if you notice these things, then it's time to be concerned. So allowing parents, giving them what they need to know and what's appropriate. It also reduces their stress level. Concrete support in times of need is something that as communities we kind of struggle with, right? Because we need to have the support there. But concrete support in times of need is not necessarily referring out unless you can make sure that the person gets to where they need to go. So providing supports that feel like relief to parents in the moment. And then teaching social and emotional competence of children. So teaching kids, again, that's about skill development, right? And being able to teach both the parents and the kids. And being thoughtful about what do our interactions with parents like look like and feel like in secondary. Because often, my experience like with parent advocacy has a lot of times been, okay, this kiddo should already know how to do this. I think we talked about that earlier. But oftentimes parents might hear just about how great their kids are in school, like your kid's doing great, can't wait to see them tomorrow. And then we have like the invitation to come and hear about how your kid is maybe not making it again today or the next day, or credit deficiency or whatever. And so thinking about how are we engaging our families? How can we engage them in a way that creates social connections, that gives them child development information in ways that feel like you're supporting and developing their skills as parents. And I'm sure many of you already do that, just thinking about like, how can we share even more ideas to do that?
I think about my work with parents of adolescents, and the adolescents might be in our treatment program or attending our alternative school. And the reality is for many of the parents, they feel tremendous guilt sometimes for their child not succeeding, not meeting their expectations and the expectations of schools. Or about the trauma that has occurred to their child earlier in life. And so there's a reason why many of those families and parents have a hard time connecting with us. And so just that overwhelming demands that are on them. And so reaching out to the families and engaging them in small ways and building that trust, demonstrating to them that you're there to support them and help them with whether that's concrete support, social connections, and them feeling like you're part of a system that isn't there judging them or pointing out their errors or failures.
One of my favorite things from Brene Brown, if you know Brene Brown, she's a social worker. She says that if you yourself are unable or uncomfortable asking for help, you cannot help others without judgment. Oof.
Yeah.
That one was hard for me. Helping with judgment. It's hard for me to ask for help, right?
I think for all of us.
Yeah.
And I think as professionals, often we can give advice a lot easier than we
Yeah.
can follow our own. Having raised 2 teenage boys, I can, you know, relate to that. It was very difficult to acknowledge that I needed help and with my son.
And if we can't, then we're, yeah, judgment is inherent in what we're doing.
So this is just an example of a visual that could be used in a trauma-informed school around discipline. And it's just recognizing that when a child is escalated, they're in that red zone, in the fight, flight, or freeze response system, we can talk till we're blue in the face. And if a kid is escalating, again, my experience in treatment, I share this a lot with people. You know, if I've got a kid that's just completely dysregulated, you know, we might use the word blowing out. And it does not matter what I say. I mean, I can just be thinking I'm saying all the right things to get them to calm down. And I have not once had a kid who is completely dysregulated stop and say, "Oh my gosh, Clark, I didn't think of that. You're right. I need to stop." Just the opposite. I mean, it's that realization that at that point, all we're doing is trying to help them calm, help them come alongside them and regulate, co-regulate until they can regulate. When they're calm and in the green, and I'm in the green, then we can start to look at interventions, what happened, what we can do differently, what they can do differently, and how I can support them. And so sometimes just having that for them to be able to identify where they're at, and for us to look at where we're at. So we're waiting to the time that we can actually have an effective intervention and response to discipline.
So I mentioned Jim Sporleader earlier, and he is the principal from Washington, whose documentary, Paper Tigers, is focused on. And he wrote a book with Heather Forbes, just thinking about like what they did to create this school environment, this culture that was trauma informed. And when they employed these, they didn't have a map. I mean, they invited Laura Porter, who's the other person who developed this information and slide presentation for you today. They invited her to come, and she had ideas about building community, capacity. And so together, they figured out how to do a trauma-informed school. And when they did that, they saw their math scores go up, their reading scores increased by significant amounts. I think their expulsion rate went down 80%. Expelling they were happy about that. They did that a lot, is what I'm saying. And their graduation rates went up. And so just by being trauma informed, all of these things that they had to present as outcomes rose like all together instead of focusing just on reading and focusing just on math. All of those things came up at the same time. So if you're ever interested, Trauma Informed Schools by Jim Sporleader and Heather Forbes, it gives you a monthly list of things to try, things to do. And I'll just give you an example, like creating a culture of safety. Talking about that as a staff, what does that even look like? Thinking about that for your classroom, like what do I do when kids blow out and how is that helpful? One thing I want to talk about is for those of you who do restorative justice, you might be able to kind of talk to other colleagues who don't have that. But like rupture in a relationship with a teacher is really common, right? So for somebody who has an overactive amygdala system, that repair with that like blowout is going to be a rupture of the relationship. And so how do we come back and repair that with our kids, right? How do we talk about, man, that was really a bummer for me that you did that, and just being honest about our feelings. So restorative justice practices, repairing relationships, I just know like one student whose family I worked with was really like hot and walked into a classroom with one of his favorite teachers. And she was in that moment busy. I'm sure you can all imagine this. And so she was very dismissive and told him to get out. And he did not receive that well because she was kind of his person in the school. And he was already feeling escalated. So he wrote something on social media, which was inappropriate. And in their policy, it says, sorry, you have to be in school suspension. But the year ended during that, and the teacher never got together with the kiddo. That's an extreme example. That happens maybe one time in 20 years. I'm just going to say that being mindful about, let me repair this before it gets too out of hand is probably a good idea. The other thing I want to talk about maybe just quickly is hot mapping is a really easy, quick way to determine which kids in your classroom have problems where. The example I'm going to use is from Colorado. They built a new high school. They had all the kids do hot mapping. So they got a map of the entire school and they got to color in green, I feel safe here. Yellow, that's not bad, but I don't love it. And red is like, I hate going here. And they had a beautiful new school. And they noticed that most of the kids had colored the cafeteria red, which the staff did not understand because it was this beautiful cafeteria with a ton of windows and it let in the sunlight. And they were thinking, what in the cafeteria is the problem? They had great food. Nobody was keeling over. When they asked the kids said, look, that glass window shows us in the cafeteria. And during an active shooter, you're not allowed to leave the cafeteria. You have to shelter in place. And so they were basically targets at that point. So the staff was able to then revisit what those policies were so that the kids could feel safer in the cafeteria. And I would be curious what hot mapping would look like during a pandemic. Like, where do I feel safe in my school, if at all? Because that would reveal some anxieties that kids have, like maybe they don't love eating with people without masks, whatever's happening. What a way to start a conversation. Anything you want to address in there?
No, and here's some additional from Jim Sporleader's Trauma Informed School that are helpful.
One thing I think looking at disciplinary and attendance statistics is really interesting too. Because what we know is your autonomic nervous system, so for kiddos with trauma in their bodies, they can have like physical ailments that take over their bodies and they just think that they're sick that day and the next day and then forever, or they vomit or they have headaches frequently. By looking at disciplinary and attendance statistics, you can kind of clue into kids like that. And you need to really clue into those kids quickly because the longer it goes, then it becomes like a mental health issue and who is going to help with that. Because our attendance is really like, if you're not here, you're not here. And then after however many, we discipline you. And what we want to do is talk about why aren't you here? Yes? Okay, thanks.
So, what we're talking about is really curating challenging behavior that might be rooted in trauma, like you would any other learning disability. Assessing the skills that are lagging, taking a different approach, breaking it down to the level that kids can be successful, and then building on that incrementally. So looking at behavior, much like we do other skills that our youth might be lacking.
Oh, sorry, I had to get a drink, Clark.
That's
Never
right.
talked this much in a long time. Okay, thank you. So what I teach in my parenting class at Climb is really helpful for any human being on the planet Earth. And it really is a mindfulness exercise. How are we reacting to the kids in our classroom, or your spouse, or your colleague, or the person in the grocery store? When you feel annoyed by a kiddo, it's usually because they want or are asking for your attention in an inappropriate way. And our response naturally as educators is to be like, okay, stop. I'm not going to reward you by giving you my attention, and yet that's what will stop the behavior. Do you see? So we're kind of perpetuating what we don't want to happen. Being more thoughtful about that thinking about this kid really annoys me every day is really an invitation to ask yourself, how can I engage this kid in the classroom so that he gets or she gets positive reinforcement for being involved? And how can you give attention appropriately throughout the day so that attention meter gets filled up? The other thing is, if you feel angry with a kid or a kid's coming at you and you're having a brawl, which I don't recommend, having that kind of reaction from you is really about power, right? Have you ever noticed yourself getting into a power struggle? Clark doesn't ever. I know I never do. Yeah. Anyway, what we want to say is about that is that's a power situation. What you want to do is give some of that control back to the kid by allowing them to pick choices, and allowing them to be engaged in your classroom in a different way that makes them feel like they're not always losing in the power struggle, because that just perpetuates more opportunity to, and oftentimes kids with trauma have trouble with authority. They're used to taking care of themselves. They're used to taking care of their younger siblings. They do not need you, thank you very much. And so that's their framework that they're coming from. So you want to think strength-based. They obviously have a lot of control, so let them control the things that they can at school. If you feel hurt by something like, man, I cannot believe this kid stole my apple from my desk because that's the last thing I thought he would ever do to me, that is just an invitation to think about a child is getting revenge, and revenge is really, I feel, not treated properly. So if you feel hurt by something, that's actually a really great way to invite yourself to think about maybe repair needs to be done here. And if you have a kid who has learned helplessness, they cannot do anything for themselves, that's really the thing to think about there is, how does everybody feel about what's happening? Usually this means the kid's given up and the adults around him or her has also given up. And so it's really about hopelessness. So how do we bring hope? How do we, like Clark was talking about, the dosing, how can I get you to be successful in a small way? And we're going to build until that's a big way.
And with that hopelessness, if we're feeling that way, it's often an example that maybe we feel like we're working a whole lot harder than they are. And so really putting that back to them and giving them hope, breaking it down so they can see how they can be successful. Often they've just given up as well. So this is just an example of having gone through adverse childhood experiences and trauma-informed training. We all go to trainings and take ideas and we want to implement them. And often then we get back to the classroom the next day, we're inundated by everything we have to do. And it's hard to then put those into action steps. So what I've done here, this is just an example of how we've taken a trauma-informed approach. We put it on the back of all of our staff's swipe cards, and or sort of a back of a badge or something, and it's those reminders. And just a couple of these, all behavior is communication. What are they trying to communicate? So slamming the door, saying nasty things, or saying, leave me alone. And so then it's communicating with them. So here's what I can do. What I'm hearing you say is you need to be left alone. I can do that. And setting up that environment that recognizes what they do. It's not about me. It's likely about something else. And what's the message behind the behavior? Listen more than we talk. Am I the right person at the right time? And trying to get the situation de-escalated. So for us, in our environment, working with kids in treatment, day treatment, residential treatment, what we found is the number one indicator of something rising to the point of needing an intervention from a school resource officer or having someone have to be removed from a classroom is often giving a consequence while the child was in an escalated phase. So again, that target, either the staff, the teacher was in the red zone when they gave that, And the client was also, the student was also in that escalation phase. And it doesn't matter what the intent is. Often I see a staff saying something along the fact of, if you don't do this, if you don't calm down, if you don't stop yelling, then this is what's going to happen. And when the child's in an escalated stage, when the student is, what happens is they hear that as a threat, that you've just given me already that consequence, and it further escalates them. And I know this is rehashing and just supporting the interventions you're always doing, but then it's about the new agreement, and it's a catchy phrase of fix the future, don't punish the past. But for our traumatized children, really what this is some practical examples that getting them calm, getting them to the point where they can look at what they did, giving them ideas on what they need to do differently in the future and how we can support them, focusing on the skills that they need to demonstrate, and then practicing it. And so that we're not punishing the past, but fixing the future. And so it may be helping them recognize. So one of the really common things that we implement in our school with kids who are in treatment is the noise canceling headphones. And it's often around overstimulation. It might be going over to an area, a quiet area, using kind of a quiet room or quiet space, and being able to put that on, might be listening to music and with a limited amount of time, and then being able to come back. And so we may set the stage for the youth who hasn't done that here's what we're going to do the rest of the day. I want you to have these with you. I want you to use those at least twice in the afternoon. And you don't have to communicate that to me at all, just use them. And what we're doing is we're really setting the stage that they can actually access those at the time that they need that. At the end of class or at the end of the day, we recognize to them, hey, I saw you use the headphones, I appreciate that. And then tomorrow morning when they come into class, it's setting up the same thing of saying, hey, I want to make sure you have these with you, or some other stress management tool that they have, so they can help, or they can start self-regulating. And those are just some examples of how we try to fix the future, build the skill that we expect them to use.
Can I give a quick example too? I just wanted to share an experience that we had with a family. So their child had trouble organizing and doing homework and bringing it back. And so one of the teachers said, you need to see the principal every morning and check in and be accountable for your work. Okay, cool. So the kid did that for 2 weeks. And then the teacher said, that was perfect. You did all of your homework. It was the best organization I've seen from you since birth. And they said, great, now you don't have to see the principal. So just inviting you to think about what we thought was a punishment was really the support needed. And because guess what happened in 2 weeks when the person didn't see the principal? Back to the same behavior because the support was not long enough. And I think sometimes we think the support, that was a punishment rather than let's build your skill and live relationship with an administrator. We thought we'll just punish you for a little bit. So just thinking about some of those things are actually effective. They're not punishments, but they're supports. Thanks, Clark.
We have examples here, more examples of earlier elementary age students calm down. But what's interesting for our kids in adolescence, they're not far from these. So having Play-Doh, having spinners, having noise canceling headphones, or even music headphones that they can listen to self-regulate. It's amazing how many kids want a weighted blanket and use those discreetly when they need to calm down.
This is really about, okay, yeah, so wrapping up, right? structures, models, the values that we have all create sort of this culture, and a lot of times we're unaware of it. So looking back at your policies, seeing how they can be more trauma informed is just an invitation to look at what are we doing unconsciously, which is very much like, you know, our kids are doing things unconsciously as well.
And yeah, and I often think about in this, it's having the relationships with other people in your building to be able to pass that baton off on that kid, share what's working, and being examples of those structures. So that's, you know, interactively, if you have questions or comments that you'd like to share, put those in the chat. You know, maybe just a visual, the child who's not embraced by the village will burn it down to feel its warmth, is just an example of kids, the importance of kids feeling like they have that relationship in our environments, that they have someone who cares about them.
Thanks to all of you for hanging in there.
And thank you, Clark and Wendy.